How you doing? It's Dan at Kent Boot Camps. Hope you're well, having a good half term. Steve and I are back. It's been a couple of weeks, but we're back together. We're going to be talking about the shoulder today. Quite important joint. It's a very unstable joint. It moves around all over the shop, and we're sitting down at a desk all day can cause a problem as the shoulder comes out of position. So Steve's going to be talking us through about how we can assess the shoulder to see if we've got good range of movement in the shoulder, and then we're going to give you some exercises to mobilize and loosen up the shoulder to get you in the correct position. Overhead position is really important. We need to be able to get overhead so that when we're pushing weights above our head, especially at boot camp, that we're not compromising our shoulder, our lower back, and getting into weird positions. So take it away, Steve. He's going to take us. He's going to show you through some assessments to see if your shoulder's in a good position or not.
Morning. So we're talking about the shoulder today. So common theme this week, seeing quite a few patients, a lot of shoulder issues, a lot of pain around this AC joint, which is this knobbly bit here. And a common theme that we see in the boot camps is people really struggling with the overhead position. They can't really lock out, they can't get that arm full range, 180 degrees up to there. Okay, so we're going to show you a few assessments, but we're just going to start off a little bit of anatomy about why can't this shoulder get to the top. And it's to do with your internal rotators. So your lats that sit in the side of here, pecs, pec major, pec minor, teres major, which comes off the shoulder blade, and they all attach underneath this arm here in what we call the bicipital groove of the humerus. Now when this arm comes up to the top there, it needs external rotation. So as my arm comes up to the top, it needs to externally rotate to get up. If it's internally rotated, there's a bony prominence there called the greater tubercle of the humerus. It's just think about it as a little bony prominence there. But what that does, it pushes against another bony prominence here called urochromum, which comes off your shoulder blade, and it doesn't allow that shoulder to get above there. So when we start pressing, if we've too internally rotated, a lot of sitting down, a lot of crunchies, things like that, that internally rotate this, then we get this thoracic kyphosis, internal rotation of the shoulders. Then when we try and press, we have to go through this lower back to try and get the power bags, the kettlebells above the head. So what we're going to do today is we're going to show you a nice easy assessment that you can do where we can get the spine in line, how much range have you got through that shoulder. Then we're going to show you how we can stretch these internal rotators, which is going to allow us to get external rotation and full range of motion in the shoulder.
Sweet.
So we're going to get Dan up against the pole. Okay, so what you're looking to do here, you're looking to get this lower back, and we're looking to tuck under, so we're looking to round the lower back, and we're looking to extend the mid back, and we're looking to see how far them shoulders come back with them 3 points on that pole there. So he's got his lower back there, his thoracic spine, which is his mid back, and his head on the pole. And as you see, as he draws his shoulders up, can he get to that pole? Can he get what's called past the frontal plane or the mid-frontal plane there? And as you can see, he can. And he's got them 3 points on the stick. Now this is a nice assessment. This is where you should be starting to see, have you got restriction in that shoulder? Are you having to push that head forward to get them shoulders up? See a lot on Facebook at the moment, big heavy weights pushing the head forward, or we're arching through that lower back. Show us a nice arch through that lower back, Dan. There we go, Luke, trying to get them shoulders up and through. So this is a nice lovely assessment. Okay, so we're going to go over to the wall, and we're going to start tweaking
Through here.
through the internal rotators of the chest. So what we can do here is we can facilitate the torso rotation. So he's going to rotate away, allowing that nice stretch through the pecs, pec major, pec minor, anterior deltoid, which is the front of your shoulder. He gets a nice stretch through there. Okay, and then we can come down onto the mat.
What are we going to do?
Half dog. to start with. So what we want to do here is we want to stretch the chest, but we want to get some nice extension through that thoracic spine, and that's going to open up the front of the shoulder. And what this is doing, it's stretching all them internal rotators to allow you to get that external rotation, so it moves that bony prominence out the way and creates space under that acromion to allow you to get the arm all the way up. Don't worry about the anatomy, all we're doing is opening up this chest, opening up the thoracic spine. It's our job here to keep you safe, to try and improve your range of motion, so we can do more complex movements, so we can get you fitter and stronger. What Dan's doing here, he's put the roller on about T7, T8, which is halfway down, just below your shoulder blades, and he's getting some nice thoracic extension there. And again, we're opening up this chest and we're getting that external rotation. Now what he's done there is he's moved it down, so we've gone up the spine, middle of the shoulder blades, and we've come all the way over. You can see Dan's got a little bit of restriction on that right arm. He's got some first rib issues going on. You can see how that left arm can get back further than that right. Good. And then we just can finish with a nice mobilization in the tabletop. Now what this does here, it's a really complex movement. You need a lot of flexibility in your wrists, and we need to drive up from there and down, and each time he comes up we get some nice extension through that spine, and it opens that chest.
Wicked.
Lovely.
Well, that should keep you cooking. So give them a whirl. Normally, as ever, the site of pain isn't necessarily what's causing it. So look at the middle of the back. If you sat down and you're stuck in position trying to open that up, Steve's giving you some great exercises to loosen off the shoulder and chest, and that should get you in a better position overhead, which should then make it a safer place to exercise. Let us know how you get on. We'll see you next week with some more biomechanical stuff. Take care now. See you soon.